It's great to be with you today. My name's Sally McCarthy. I'm the president of the International Federation for Emergency Medicine. I hope you're enjoying the leadership course. It's wonderful to be asked to talk to you this morning about my reflections on leadership in emergency medicine. My career in emergency medicine has been a pretty long one, actually. I've been an emergency physician since 1993. And I've held many formal leadership roles, including department director of many departments, chairing many committees, both at the hospital, state and national and international levels, and also in things other than emergency medicine. I was the president of the Australasian College for Emergency Medicine, and now I'm the International Federation president. So I've learned a lot in my leadership journey. I've observed a lot, and experiences has taught me well. So I'd really like to bring you along on a little bit about my journey, and also some of the insights that I can give you on leadership in emergency medicine. The first thing I'd like to say really is that leadership's a choice. It's not a choice insofar as all of us as doctors being leaders in the system. Naturally, doctors are regarded as leaders because of your education and the position you hold, and particularly when you're a specialist and as you become more senior through your career. But accepting a formal leadership role is a choice. And for all of us, no matter what our particular work role is, the way we exercise leadership is a choice. So I'd ask you to think about the sort of leader you want to be. This isn't something that most people think about, I don't think, when they first step into a leadership role. But we're all pretty aware of examples of leaders we love working with, and leaders that we really don't like working with, and leaders who nobody really respects, and there are other leaders who are, highly respected no matter what their role. So it's a choice. We need to think about what sort of leader we want to be in the system. So when I thought about giving you this talk today, I thought there are a few questions I'd like you to think about, and they're these ones here. So why do you want to lead? What is it that you're trying to do in your leadership role? So is it fixing something in the system? Is it advancing your career? Why do you want to lead? That's the first question. What do you have to offer? So I'm sure you've already learned a lot during your journey in medicine, and improving your leadership skills and being aware of what we need to do as a leader is important. And I guess the key thing is, what do you have to offer that separates you from other people in your leadership role? So what's unique about you and your skills? What do you want to achieve? What are you going to do when things are hard? It's really easy to be a leader when you've got adequate resources, you've got really senior staff, things are going well, the emergency department isn't under overwhelming demand. And the hospital administrators are supportive. But all of these things certainly don't apply all the time. And emergency medicine is a pretty difficult area to be a leader, just because we combine the public face of the hospital, and expectations from the community, politicians, the broader public, with expectations from our leaders within the hospital. So clearly they have a budget. We have fixed resources. Things are quite difficult to change in the short term. So sometimes it's really tough being a leader. And I think the things that you do in these tough times will really mark you as a great leader, or as a poor leader. And there's nothing wrong with not being a leader. If you decide that you don't want to be a leader anymore, just resign. Hopefully you will have trained other people to take over. So what are you going to do when things get tough? That's something really to think about. Who are your people? By that I mean, who are the people who are going to support you over your career? Naturally, your friends and family will be in that group, but there's also colleagues that you make along the way, people you get on particularly well with, you work well with. So just think about your relationship with them as a long-term one. Who are the people that you're going to need to meet, to learn from, and who is going to be on your team, and where is your team confined to the ED? Is it the hospital? Is it broader than that? Thinking about who's on your team is important. What are the rules for sustaining leadership over one's whole career? I'm going to touch on that further on. And you need to think about where you want to be in 5, 10, or 20 years for sure. Just a little bit about my so-called leadership journey. I think that I ended up in leadership because of the way I was raised in my family. And that was with a really strong sense of what's the fair thing to do, that people all deserve equity and justice, and also an obligation to do something about it. If you see something wrong, you need to fix it. Don't expect other people to do everything. You need to do it. So as a junior doctor and an early years specialist, my strong focus was on being as clinically competent and clinically good as I could be, and excelling in my clinical role. And that is a really important thing for any leader in a clinical sphere. You've got to be great at what you do clinically. You can't cut corners. You've got to be a hard worker, and you've got to strive to continuously do the right thing, because people judge your competence as a leader on what you're like clinically. I observed things could be better. So the reason that I first took on a role in the emergency department leadership was because there were things about my workplace that I thought could run better. Staff could be treated in a different way. We could organise things differently. We needed to collaborate with other services. And I was offered the opportunity and took it. And I've since been offered many opportunities during my professional career. I haven't taken all of them, and so my journey could have taken a different direction. But I've certainly, I think, made the most of the opportunities that I have taken up. One needs to improve skills and knowledge along the way, so we need to continuously learn. I did an MBA. That was something very useful to apply frameworks from the corporate world into the medical world. And I think it gave me credibility as a physician in leadership. I'm not saying that, doing emergency medicine with all its prioritization and management of disasters and resuscitation doesn't teach you a lot of those things. But we also need to think about speaking the language that other administrators and hospital leaders speak. And certainly some of the leadership courses do give you that language. I've stayed the course, and that's been despite many challenges along the way. So everyone has challenges. Our life changes as we have children, and there's family, things that we have to be there for. There are changes at work, changes in people we work with. Resources can be tough with, government change, things change. So there's a lot of ups and downs in leading an emergency department and in leadership more generally. One of the things that sustained me is having a sense of humour and maintaining that. And I think seeing the funny side of even the smallest, almost irritating things, or some of the behaviours that you think are very difficult to manage in your administrators or colleagues, sometimes just stepping back and thinking about it and keeping a sense of humour just helps you get past that. And don't really bother about the small things. If you can't change it, don't spend time worrying about it. It'll just wear you out. This is one of my favourite leadership quotes. Do what you feel in your heart to be right, because you will be criticised anyway. And I think that sums up leadership, and particularly in the emergency department. No matter what you do, no matter how correct it is, no matter that it's the right course, there will always be people who criticise you, and you have to wear that as a leader. If you're making everyone happy, you're not making hard decisions, and you're not doing anything to push the organisation along by leaps and bounds. If you play it safe all the time, you don't really achieve anything much. So be prepared to be criticised. Leadership's very important, as we all know, and good leadership has become even more so in our recent experience during the COVID-19 pandemic. Good leadership can foster an effective response, keep the morale of staff up, and draw people to you to get things done. It can strengthen resilience of the whole team. Poor leadership, on the other hand, has undermined the response to COVID in particular, but this cuts across to more than the pandemic, and can undermine staff morale, make the staff ineffective, and you can lose good staff. People don't want to work for a leader who doesn't lead them well. So what do good leaders do? In emergency medicine, they focus on staff safety as a priority and staff wellbeing. Without our staff, we can't do anything. Our staff have to work, 24 hours a day. They have to encounter people that may be violent or agitated. They're always jumping from one thing to another. It's a difficult place to work. So as a leader, you need to think about this and support your staff, and staff need to know that you support them. Listen to your staff. We work with very sort of smart people who are dedicated to improving care for patients and who've been in the system for a long time. So they have many great suggestions, and we can decide as a team what to implement. But once we've decided, we need to all support that, and we can monitor that and feed back to the team. But the team, a good team that communicates, needs to act as one. So communication is important, open and honest communication, transparent, and while remaining optimistic. There's no point communicating to the team that you think this is completely hopeless, but you're going to do it anyway. I mean, if something's really a waste of everyone's time, just stop doing it. Do something better. Maintain consistent flow of information. That really helps the emergency team, it helps the medical staff, and it helps the administrators. So if you let people know what's going on, you're more likely to build their support and collaboration, and they're more likely to give you information that you'll need to keep doing things well. Relationship building is important. So the relationships you build in the good times will stand you in good stead for the challenges. So when things are tough, if your people get on with you, they're more likely to think, yes, she did this or he did this for the right reasons. I'm going to cut him some slack. If you don't have good relationships and things go wrong, people won't tolerate that, and you'll face a lot more difficulty, perhaps undermining and opposition. So building those relationships and maintaining them is really important. Relying on your team to lead. So it's not all about one leader in emergency medicine or really in any leadership role. It's about distributing leadership within the team. So we've got a lot of challenges, and the more people we can get leading segments of the solutions, the better. Practice self-care. So you want to personally avoid burnout, and you want your team to as well. So, maintaining your family time, trying to have an interest outside emergency medicine, although that's going to be very difficult sometimes, keeping fit, avoiding drugs and alcohol. There's a lot of evidence that leaders under stress can do things that they otherwise wouldn't do in terms of relying on crutches like, poor food choices, drugs and alcohol. So staying fit and healthy really helps you. And understand that you're fallible. It's inevitable that as a leader, you're going to make mistakes. And the best thing to do is to try to learn from them, because we all make mistakes, and we need to accept accountability and be honest and accountable. So I've mentioned the impact of COVID and how it's really put leadership in emergency to the fore. So for the first time for probably a long time, emergency care has been front and centre of the health system, and also really recognised in the community for providing that care at the front. The rest of the health system has been unprepared, and in fact, many emergency departments have been unprepared. But what emergency leaders have stepped up and organised their own departments, often the whole rest of the system, and kept that leadership going despite the the stresses they've been facing. So there's been a huge recognition of the importance of good emergency care, emergency medicine, and emergency medicine leadership. And while we think about how this is one positive feature of the pandemic, we need to look at what we've learned and try to retain that and bring it into the future. So once we've moved on from the pandemic, which won't be for a while, but when it does happen, we need to maintain the focus on advocacy for emergency medicine and good emergency care for the community, and retain those lessons of leadership. So the fact that we successfully reorganised the system and managed to deal with many, more patients than we normally do, and did that quickly, tells us and the rest of the system that this is possible. So leaders start out usually by wanting to change something. So great leaders don't set out to be a leader, they set out to make a difference. Some people do set out to be a leader, and they set out to climb the leadership roles within hospitals and perhaps get to be the top person and think about, this will be great, I'll sit around in an office all day, earn lots of money. But most people who assume leadership in emergency medicine do so because they can see that things need to improve and they think that they've got a lot to offer. So characteristics of great leaders. There's been a lot of research on leadership and what makes a great leader, and these are character traits. So many of these are inherent in a person's formation as during their upbringing and as they get older through life. But if we're aware of what these characteristics are, we can be aware, self-aware, and cultivate them in ourselves. So thousands of studies of corporate leaders have shown that common characteristics of great leaders are these ones here, which are exercising good judgment, being courageous, taking the hard decisions, not just the easy ones, having a lot of drive, so maintaining their energy because it's a long road, collaborating with others and building relationships with them, acting with integrity at all times. So if people can't trust you, they're not going to trust you to lead them. You have to do what you say you'll do, and do that always, and don't ever veer from that. Temperance means really keeping a cool head. So try not to react quickly or in anger to things that are challenging. And that's all of these things are things that we can all work on and improve at. Being accountable, so not just for successes, but for failures and also for mistakes. Striving for justice, so trying to run, being fair as a leader, finding out full information before you make a decision, considering the impact of all those decisions on others. Being humble, you're not the source of all knowledge and expertise. You work with a very smart and dedicated team, and there are many other people who can teach you. So humility is a really important characteristic in a leader. You need to be confident, though, as well as humble. You can't be so humble that you can't lead and you don't maintain the courage of your convictions. Exercising humanity, so seeking to understand people and being accepting of human failings and complexity is really important. And transcendence really is having a greater purpose in life. So being able to look ahead into the future and just understanding where what your objectives are as a leader and how that's going to form the sort of health system or society we want to live in. As a leader, you always need to lead by example. People are going to look at every behaviour or action you do, whether you think people notice or not, they'll be noticing. So if you're doing anything counter to what you say others should do, people will pick that out, and that will undermine your ability as a leader by letting people know that, you know, they may not be able to trust you or rely on you. So being an authentic leader is always practicing within your core values, not lying about things, not trying to cut corners and tell other people to do things but not do them yourself. So authenticity as a leader is one of the absolutely fundamental must-haves to be successful. And these are the behaviours that you need to display to be authentic. Have integrity, act according with your inner values, and do that all the time. Behave ethically. As I said, don't think that people don't know what you're up to, because it always comes out. Never do or say anything you wouldn't be happy to have publicised in the media, both immediately and in 10 years' time. That's one good way of considering decisions that you might take. And think about if this was happening to me, would I like this? Is this the right thing to do? Challenge yourself and others. You want to be able to have the team operating to high performance, and that is just from challenging them, but challenging yourself as well. That shows respect for people's capacity. If you're not giving people challenging tasks to do, they may think that you don't think that they can do those challenging tasks. So that's important. I've mentioned being self-aware and aligning values, listening more than talking. We've talked about trust, and you must support your team and your staff. So a lot of those things are really about exercising emotional intelligence when you interact with your team, as well as being an authentic person in your leadership role. So when I say emotional intelligence, what do I mean? So trying to manage your own emotions, but also being aware of other people and what's the circumstance that they've got as a background to whatever you're concerned about, or the behaviour. Being aware of, you know, what their situation is, getting to know them, and being aware, exercising empathy, putting yourself in other people's shoes. That's really important. If you're not prepared to do the thing yourself, don't expect other people to do it. Resolve conflict productively. So try to separate the issues from the person. Chat about the issues in a private space. Don't have conflict in public. It undermines the well-being of the team, and also can really undermine public trust in the health system if that's happening in the emergency department. And communication's obviously key to all of this. Building a team of leaders. And how do you do that? By respecting the capacity of your team, delegating tasks, but also delegating tools and resources to get that done, and empowering them to make decisions. And when they do, backing them up. You can check in, you can find out what's going on, but trust people to be able to work out the best way to get something done. Always, as a leader, always stand up for what is right. These are just a few examples of the many media statements and public sort of statements that I've made about things that need to be fixed in the health system or in the emergency department. And I'm not suggesting that you need to go to the media. That is a last resort. That's only when you've done everything you can within the system, within the health system, you know, outside your hospital or where you're working. You've tried other avenues to get change. You might have gone to the hospital board. You might have got your colleagues and other supporters on side and got them to advocate as well. But if things are dangerous and nothing's working, sometimes speaking to the media is the right choice, because the media directly speaks to the community who will support what you want to do. So I guess my message is, don't be afraid to always stand up for what is right. So there's certain things that as an emergency leader, you need to not put up with in your emergency department. And the one example I'm mentioning here is gender bias or sexism. There are others, you know, poor communication with patients, rudeness, not treating people as the staff would want to be treated. But gender bias is something that I'm sure you'll hear about, or you've already heard about on the course. And it's a very, it is a real problem, because that means half your team, or a proportion of the team, are not actually able to contribute fully according to their skills. So you must accept gender bias exists. It exists within men and within women. And that's because we're conditioned growing up in a society to adopt the gender views about, or the views about particular genders that the society holds. So we have assumptions about people. We might assume women are always the primary caregiver for children. We might assume that women are not serious about leadership roles. We might assume that men don't know anything about building relationships and caring for people. So gender bias undermines the capacity of your department, but also of individual team members. And that is something you must explicitly address. You have to act against sexism, harassment, poor behaviour, even the slightest generalisation and insult of women in the emergency department, because it's usually directed against women. And you have to work to remove conscious and implicit bias by educating yourself and colleagues, and by understanding that people that stand by and say nothing are the problem as well as the perpetrator. They have to act. And the sooner people start stepping up, the sooner we can remove the problem. And hopefully we're doing this not by just pushing it underground so it's still occurring, but by educating people and letting people understand why this is destructive and why it occurs. And we need to actively weaken these stereotypical behaviours. There are destructive leaders around. They hardly tell their teams anything. That's on a need-to-know basis. They use their pressure, fear, instill fear, and use hierarchy to control and direct staff. And then they find that staff are not investing their full selves, I guess, at work. They're doing the minimum that they can because of the way the leader's behaving. Whereas positive leadership lets staff contribute a lot of discretionary behaviour that they don't have to contribute, but they want to contribute. Poor leaders and destructive leaders tolerate poor behaviour in the team. They don't call it out. They don't stop it, even when people directly complain to them. If it's too hard for them to do something about it, or if it hasn't impacted the results produced, they won't do anything. And so that's really destructive to the whole team. They act in their own interest. They try to hold on to power, and that's part of the lack of sharing of information. And eventually they drive their good staff away. People leave. They don't want to work for these sort of leaders, and people who stay completely disengaged. I just want to spend the last few minutes talking about some absolute failures in leadership and what lessons we can draw from these. So first of all, you may have heard the Mid Staffordshire Trust inquiry in the UK. And this was where there was a particular trust that was having more complaints and critical incidents and patient deaths, and there was than similar places. Their performance was really poor, but this went on for some years despite complaints of appalling behaviour of patients by patients' relatives and by individual staff. Whistleblowers were shut down. No one did anything until finally there was a lot of media attention, and then finally there was an inquiry. And this is a quote from one of the doctors, one of the senior doctors, giving evidence at the Francis public inquiry. And I think this is really an interesting quote because it talks about the impact of a poor organisational culture, extremely poor leadership, a bullying culture. And I'll just read it to you. So this senior doctor said, perhaps I should have been more forceful in my statements, but I was getting to the stage where I was less involved and heading to retirement. I did not have a managerial role, and therefore I did not see myself as someone who needed to get involved. Perhaps my conscience may have made me raise concerns if I'd been in a management role, but I took the path of least resistance. There was less impact on his patients. There were veiled threats at the time that I should not rock the boat at this stage in my life. For example, because I needed discretionary points or to be put forward for a clinical excellence award. So this person was utterly disengaged and did not see the personal responsibility that they had to do something. This is another example of a leadership failure. This is Dr. Bawagaba, again in the UK, who was a junior doctor who'd just come back to work, who trained in the UK and had just come back to work after 15 months of maternity leave. And she ended up being charged with negligent manslaughter and being struck off the medical register, but then reinstated. And she was at work on her first day back after maternity leave in a completely dysfunctional system, a hospital that suffered from extremely poor leadership. So there were issues across the board. She had to work excessive hours because there was short staffing. She was unfamiliar with the duties in the ward. The computers were down. There were delays to testing, delays in checking test results, delay in prescribing and administering antibiotics, very poor nursing care and no monitoring of the patient. A consultant did not assume responsibility, and I should say this was about a sick child who subsequently died. The junior doctor herself failed to be assertive insofar as not requesting the consultant to actually see the patient. There were patient factors. The patient had other underlying illnesses, and the mother of the patient gave the patient some medication which may have contributed to the death of the patient. And the work environment was extremely unsafe for this junior doctor. So the issues across the board were the lack of resources and poor management of the system in which the doctor worked. But then also the doctor feeling that in her position, she wasn't able to stand up or didn't, exercise her, responsibility to say to the consultant, this child's sick, I'm out of my depth, or I've got too much work to do, I need you to see the child. And the doctor was not assisted by the system. And in fact, this made the headlines around the world because this doctor was sacrificed with the system covering for itself. And it eventually came out that the system issues were overwhelming. So this is a real failure of leadership, both to a small extent from the individual doctors or the junior doctor involved, Dr. Bawagaba, failure from the consultant to take responsibility for the patient, but an abject failure by the leaders of that health system to provide a working environment that was safe for patients and staff. This is another true example. This is an example of a doctor in Vietnam performing cosmetic surgery in his rooms on the weekend, and then the patient inadvertently died. But instead of taking responsibility, the doctor and his staff dumped the patient's body in the river and tried to cover up that the patient had ever been there. This doctor is clearly not displaying the values that we talked about in good leaders, and that's appalling behaviour, but again, a failure of professional responsibility and leadership. This is another story about the doctor issues, leadership issues from the doctor and the system. So this was a surgeon who had worked in the USA and had been withdrawn, had his registration withdrawn in 2 states. He was, even so, his colleagues gave him glowing letters of recommendation. He was, I'm sorry why this is flicking back, I'm not quite sure. He was employed in Queensland in Australia and performed surgeries on patients that he wasn't qualified or skilled to do. He was associated with the death of many patients. and eventually was charged, and there were multiple inquiries. And one of the inquiries also found that the health system was culpable in terms of not properly assessing him and not doing anything about complaints. So the issues of leadership here are personal in the doctor concerned, the system in not following up on complaints and not checking credentials, and then the broader leadership of the health system in trying to cover up wrongdoings. So these are some, pretty horrible examples of leadership failure. And you can see in all of those examples, people did not exercise the characteristics which we need for great leadership. The ED process itself can lead to failures for patients. So not having processes like accurate triage, doing vital signs when they need to be done, acting according to abnormalities, not responding to patients' and relatives' complaints. So this could be looked on as a failure of leadership in the ED. In both of those particular cases, the EDs were under-resourced and overwhelmed. And so it's a failure of hospital leadership as well. Just to finish on, I wanted to give you a little bit of career advice for your long leadership careers in emergency medicine. So the top things, I think, are the first three. So always put the patients and your staff first. Always act with integrity and be a trustworthy person, and be clinically excellent. This remains important for your credibility if you're still practicing in the emergency department. Take the time to build rapport with the patients and establish a good relationship. Talk to patients and colleagues honestly. People always want to know the truth, but really it's how you communicate that's important. Only ask of others what you're prepared to do yourself. So if you don't want to be rostered on X number of night shifts with no breaks yourself, don't roster other people on those rosters. Listen more than speak. Do get involved in more leadership once you've decided to step into leadership. So join medical societies, get involved with your hospital leadership team within the state, get into politics. That's really the only way to change the health system. Sometimes doing nothing is better than doing something, and sometimes that's hard to do. So understanding when to act and when to wait is something you need to cultivate as a good leader. Commit to lifelong learning and a so-called growth mindset where you've always got something to learn. Try to maintain your interests outside medicine and be a well-rounded person. And obviously this is extremely difficult when you're so busy and there's just so much on your mind as a leader. So try to be a good example to your patients as well by being physically healthy and looking after your mental health as well. This helps avoid burnout. Just sort of put work in perspective. It's just work. There's so many good things going on in your life. Don't get too worried about work things. Really, if you are really unhappy where you work, just examine why that is, and you may need to change positions, and that's not such a bad thing. As I said before, a sense of humour helps. So there's lots of things you'll find that are really funny along the way, and you can look back at what you've achieved and what challenges you face and see the humour in much of it. Play the long game in leadership. So sometimes you find that whatever you've suggested or whatever you've said, no one's listening at the time. And it might be 10 years later, might be longer. I had the experience of a year or so ago of being able to implement something 13 years after I first advocated for it. So you never know. Sometimes it just takes a long time, and it is a long journey, leadership in emergency. So back to the questions, these are the things you need to focus on and think about where you want to be, what are the skills you need to get there, but what sort of a person you are and you want to be as a leader. And that really summarises my reflections on leadership. Thank you very much for listening. I hope you enjoy the rest of your course. Thank you.